From Segerstrom High School, this is Tony Medina and David Garcia, and you are about to enter Our Minds,
a podcast where we discuss the connection between marijuana and depression.
First and foremost, we just want to say that this podcast isn't a debate. It is simply our unbiased opinion. And after intensive research, we will determine if marijuana use is linked to depression.
Research suggests that marijuana smokers are diagnosed with depression far more often than non-smokers are. Heavy users appear depressed as a result of the dulling effects of the drug on feelings and emotions. There's also evidence that shows that teenagers who attempt suicide are more likely to be under the influence than those who don't. In a study of patients that were diagnosed with depression, researchers found that marijuana use was common and that its use was associated with poor recovery and behavior. Several studies have linked marijuana use to increased risk for psychiatric disorders including schizophrenia, depression, anxiety, and substance use disorders. But whether and to what extent it actually causes these conditions is not always easy to determine. The amount of drug use, the age at first use, and genetic vulnerability have all been shown to influence this relationship. The strongest evidence to date concerns links between marijuana use and substance use disorders and between marijuana use and psychiatric disorders in those with a pre-existing genetic or other vulnerability. Inconsistent and modest associations have been reported between marijuana use and suicidal thoughts and attempted suicide among teens. Marijuana has also been associated with an amotivational syndrome defined as a diminished or absent drive to engage in typically rewarding activities. Because of the role of the endocannabinoid system in regulating mood and reward, it has been hypothesized that brain changes resulting from early use of marijuana may underlie these associations, but more research is needed to verify that such links exist and better understand them. Another study found an increased risk of psychosis among adults who had used marijuana in adolescence and also carried a specific variant of the gene for catechol O methyltransferase, an enzyme that degrades neurotransmitters such as dopamine. Marijuana use has also been shown to worsen the course of illness in patients who already have schizophrenia. As mentioned previously, marijuana can produce an acute psychotic reaction in non-schizophrenic people who use marijuana, especially at high doses, although the effect fades away as the drug wears off.
Amber L. Bohorik, Ph.D. from the UCSF Weill Institute of Neurosciences at the University of California, San Francisco, and colleagues recruited 307 outpatients with depression from the Kaiser Permanente Center Department of Psychiatry in Union City in Fremont, California. These researchers assessed the patients at baseline, 3 months, and 6 months on symptoms and generalized anxiety disorder scale functioning and past month marijuana use. Longitudinal growth models were used to examine patterns and predictors of marijuana use and to assess its impact on symptoms and functional outcomes. The researchers found that a considerable number of patients used marijuana within 30 days of baseline. Over 6 months, marijuana use decreased, but patterns varied by demographic and clinical characteristics. Marijuana use was significantly increased in patients aged 50 and older over 6 months compared with the youngest age group, although patients aged 50 and older were less likely to use marijuana at baseline. 6-month recovery showed that marijuana use was significantly associated with worse recovery symptoms and anxiety symptoms. Their results indicate a need for providers to ask depressed patients about their marijuana use, to inform those using marijuana of its potential risks, and to determine treatment they need. Education efforts about the adverse impact marijuana use can have on depression are needed, with the focus on subgroups. In other words, young people or older adults on high depression severity patients are at risk for a poor outcome. For this next segment, we're going to have an anonymous guest speaker talk about her experience with marijuana use and depression. So, do you think the stereotype is true that marijuana use is linked to depression?
Honestly, I think so, yes. Personally, I feel that marijuana does lead to depression.
Are you comfortable telling us about any personal experiences?
Yes, as long as I remain anonymous.
Okay.
So, you asked me if depression and marijuana are like linked together, right?
Mm-hmm.
So, I believe when I was depressed, I would use marijuana for personal reasons to reduce anxiety and calm my depression. But as after months and weeks of the use, I just felt like I wasn't going anywhere. Like, yeah, I was temporarily happiness, but I wasn't able to like move on and become better. I felt like marijuana was bringing me down all the time after a while and just being sad and numb. So after I decided no more.
So, how do you think it affected your personal life?
My personal life, well, from just the small things with the family, like family events, like even for my little brother's birthdays, like we would have parties downstairs and I would just stay up in my room and like, smoke. Because I thought at the moment that it was going to reduce my sadness, but it obviously didn't. It was just bringing me down all the time. And not just with that, but also with school. My academics was not going well. I started slacking off. I would not show up on a regular basis, like max like 1 or 2 times a week. And this affected my academics because my GPA decreased, my truancies were increasing, and now I won't be accepted into colleges.
Thank you for coming onto our podcast and speaking.
Yes, of course. My pleasure.
After intensive research, we have learned that depressed people have a slower recovery time while under the influence of marijuana, and that these effects may be linked to each other.
In helping us make this decision, we took into consideration all of the statistics around it and the experiments conducted to patients with depression. This is an ongoing discussion that would take many years of intensive research and experiments to determine the actual link between marijuana use and depression.
So we would like to ask you, the viewer, a question. Do you think that marijuana is linked to depression?